Immunoglobulin E is a class of antibody isotype that has been found only in mammals. IgE exists as monomers consisting of 2 heavy chains and 2 light chains, with the I-micron chain containing 4 Ig-like constant domains. IgE's main function is immunity to parasites such as parasitic worms like Schistosoma mansoni, Trichinella spiralis, and Fasciola hepatica. IgE may also be important during immune defense against certain protozoan parasites such as Plasmodium falciparum. IgE also plays an essential role in type I hypersensitivity, which manifests various allergic diseases, such as allergic asthma, most types of sinusitis, allergic rhinitis, food allergy, and some types of chronic urticaria and atopic dermatitis. IgE also plays a pivotal role in allergic conditions, such as anaphylactic reactions to certain drugs, bee stings, and antigen preparations used in specific desensitization immunotherapy. Although IgE is typically the least abundant isotype blood serum IgE levels in a normal individual are only 0.05% of the Ig concentration, compared to 75% for the IgGs at 10 mg per milliliter, which are the isotypes responsible for most of the classical adaptive immune response. It is capable of triggering the most powerful inflammation reactions. IgE was discovered in 1966 by the Japanese scientist couple Teruko and Kimishige Shizaka. Receptors: IgE primes the IgE-mediated allergic response by binding to Fc receptors found on the surface of mast cells and basophils. Fc receptors are also found on eosinophils, monocytes, macrophages and platelets in humans. There are 2 types of Fc-micron receptors, Fc-micron Ri, the high-affinity IgE receptor, Fc-micron Rii, also known as CD23, the low-affinity IgE receptor. IgE can upregulate the expression of both types of Fc-micron receptors. Fc-micron Ri is expressed on mast cells, basophils, and the antigen-presenting dendritic cells in both mice and humans. Binding of antigens to IgE already bound by the Fc-micron Ri on mast cells causes cross-linking of the bound IgE in the aggregation of the underlying Fc-micron Ri, leading to the degranulation and the release of mediators from the cells. Basophils, upon the cross-linking of their surface IgE by antigens, release type II cytokines like interleukin-4 and interleukin-13 and other inflammatory mediators. The low-affinity receptor is always expressed on B cells, but its expression can be induced on the surfaces of macrophages, eosinophils, platelets, and some T cells by IL-4. Physiology: there is much speculation into what physiological benefits IgE contributes, and, so far, circumstantial evidence in animal models and statistical population trends have hinted that IgE may be beneficial in fighting gut parasites such as Schistosoma mansoni, but this has not been conclusively proven in humans. It is most likely beneficial in removal of hookworms from the lung. Although it is not yet well understood, IgE may play an important role in the immune system. Unregistered trademark S recognition of cancer, in which the stimulation of a strong cytotoxic response against cells displaying only small amounts of early cancer markers would be beneficial. If this were the case, anti-IgE treatments such as omalizumab might have some undesirable side effects. However, a recent study, which was performed based on pooled analysis using comprehensive data from 67 phase I to IV clinical trials of omalizumab and various indications, concluded that a causal relationship between omalizumab therapy and malignancy is unlikely. Role in disease: atopic individuals can have up to 10 times the normal level of IgE in their blood. However, this may not be a requirement for symptoms to occur, as has been seen in asthmatics with normal IgE levels in their blood. Recent research has shown that IgE production can occur locally in the nasal mucosa. IgE that can specifically recognize an allergen has a unique long-lived interaction with its high-affinity receptor Fc-micron Ri, so that basophils and mast cells, capable of mediating inflammatory reactions, become primed, ready to release chemicals like histamine, leukotrienes, and certain interleukins. These chemicals cause many of the symptoms we associate with allergy, such as airway constriction in asthma, local inflammation in eczema, increased mucus secretion in allergic rhinitis, and increased vascular permeability, it is presumed, to allow other immune cells to gain access to tissues, but which can lead to a potentially fatal drop in blood pressure as in anaphylaxis. Although the mechanisms of each response are fairly well understood, why some allergics develop such drastic sensitivities when others merely get a runny nose is still one of science's hot topics. IgE is known to be elevated in various autoimmune disorders such as lupus, SLE, rheumatoid arthritis, RA, and psoriasis, and is theorized to be of pathogenetic importance in RA and SLE by eliciting a hypersensitivity reaction. Regulation of IgE levels through control of B-cell differentiation to antibody-secreting plasma cells is thought to involve the low-affinity receptor Fci micron RII, or CD23. CD23 may also allow facilitated antigen presentation, an IgE-dependent mechanism whereby B cells expressing CD23 are able to present allergen to specific T helper cells, causing the perpetuation of a Th2 response, one of the hallmarks of which is the production of more antibodies. Role in diagnosis. Diagnosis of allergy is most often done when a physician reviews a patient's history and finds a positive result for the presence of allergen-specific IgE when conducting a skin or blood test. Specific IgE testing is the proven test for allergy detection. Evidence does not show that indiscriminate IgE testing or testing for immunoglobulin G can support allergy diagnosis. Drugs targeting the IgE pathway. Currently, allergic diseases and asthma are usually treated with one or more of the following drugs: antihistamines and antileukotrienes, which antagonize the inflammatory mediators histamine and leukotrienes, local or systemic corticosteroids, which suppress a broad spectrum of inflammatory mechanisms, and short or long-acting bronchodilators, which relax smooth muscle of constricted airway in asthma. Long-term uses of systemic corticosteroids are known to cause many serious side effects and are advisable to avoid, if alternative therapies are available. IgE, the IgE synthesis pathway, and the IgE-mediated allergic inflammatory pathway are all important targets in intervening with the pathological processes of allergy, asthma, and other IgE-mediated diseases. The B lymphocyte differentiation and maturation pathway that eventually generate IgE-secreting plasma cells go through the intermediate steps of IgE-expressing B lymphoblasts and involves the interaction with IgE-expressing memory B cells. Tanox, a biotech company based in Houston, Texas, proposed in 1987 that by targeting membrane-bound IgE on B lymphoblast and memory B cells, those cells can be lysed or downregulated, thus achieving the inhibition of the production of antigen-specific IgE and hence a shift of immune balance toward non-IgE mechanisms. Two approaches targeting the IgE pathway were evolved and both are in active development. In the first approach, the anti-IgE antibody drug amlodipine recognizes IgE not bound to its receptors and is used to neutralize or mop up existing IgE and prevent it from binding to the receptors on mast cells and basophils. Fasciola has been approved in many countries for treating severe, persistent allergic asthma. It has also been approved in March 2014 in the European Union and the US for treating chronic spontaneous urticaria, which cannot be adequately treated with H1 antihistamines. In the second approach, antibodies specific for a domain of 52 amino acid residues, referred to as Cy-micron MX or M1 a Euro unregistered trademark, present only on human MIgE on B cells and not on free, soluble IgE, have been prepared and are under clinical development for the treatment of allergy and asthma. An anti-M1 a Euro unregistered trademark humanized antibody, quilzumab, is in phase I clinical trial. In 2002, researchers at the Randall Division of Cell and Molecular Biophysics determined the structure of IgE. Understanding of this structure and of the interaction of IgE with receptor Fci micron RI will enable development of a new generation of allergy drugs that seek to interfere with the IgE receptor interaction. It may be possible to design treatments cheaper than monoclonal antibodies that use a similar approach to inhibit binding of IgE to its receptor. References. External links. Slide presentation of degranulation processes.